I remember wondering why the way you vote started determining your health-related behavior. Why does I'm a Republican, therefore I'm not going to wear a mask? I'm a Democrat, therefore I'm going to get a vaccine. It makes about as much sense as I was born at Cedar Sinai and therefore I like pasta. Why do you think that happened during COVID? Why do you think people started politicizing health?
I don't know, but it is true what you point out. Unfortunately, it did become very, very politicized. When the pandemic started, I was of the view that we ought to have a national program. And obviously, as the CDC director, I thought maybe I should have one of the leadership voices in that. It was decided by the administration that we wouldn't do that, that we would let each governor develop their own perspective on how to handle the pandemic in their own states. And as a consequence, we had multiple different points of view. As you point out, certain trends evolved. I think you would easily say that one of the problems with the COVID response, looking backwards, was there was enormous government overreach on a number of issues. And I do think a lot of the pushback that took political sides had to do with that government overreach. Mandating vaccines. This vaccines for COVID should have never been mandated. Once they were mandated, you had people that were pro mandate and anti mandate.